people who were infected, who came into the healthcare system, have been on ventilators. The longer you are on a ventilator, the more probability of a bad outcome. We now have people who have been on a ventilator for 20 days, 30 days. The longer you are on a ventilator, the more likely you're not going to come off the ventilator. And that is what is happening. Because we do have people who have been on for quite a period of time. And those are the people who we are losing. That has always been the way. The longer stays without recovery lead to a higher death rate, right? And that's not just COVID, that's any medical situation that you've dealt with. That is the natural consequence. When you have older, sicker patients who are staying on ventilators longer, they usually have a worse outcome, right? And I think people get that from their usual experience. What we're seeing now is that is happening. We've had people on for a very long time, and they haven't gotten better. And they are passing away. So the number of deaths is at 385. It's up from 285. And since we still have a large number of people on ventilators for a long period of time, the experts expect that number to continue to increase, right? And we've said this from day one. You get the infection, 80% self-resolve, they don't go into the hospital. Some percentage go into the hospital, get treated, and go home. Some percentage go into the hospital, need a ventilator, they're on the ventilator, and they never come off the ventilator. And that is a situation where people just deteriorate over time. And that's what we're seeing. That is that vulnerable population, that very small percentage, 2 or 3% of the population who we've always worried about. But that's what we're seeing.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.